Delving into the fascinating world of vitamins. It's like uncovering the tiny cogs and gears that keep our magnificent human machine running smoothly. You want a comprehensive exploration, a deep dive into each essential vitamin, the havoc its deficiency can wreak, the signs to watch out for, the path to recovery, and where to find these vital nutrients. Absolutely. Let's embark on this enlightening journey together. The marvelous world of vitamins. Vitamins, these organic compounds, are indispensable micronutrients that our bodies need in small amounts to function optimally. They participate in a vast array of biochemical reactions, from energy production to nerve function and immune defense. Think of them as the unsung heroes of our health, working tirelessly behind the scenes. Vitamin A. The visionary and immune supporter. Vitamin A, a fat-soluble vitamin, exists in two primary forms: retinol, found in animal sources, and beta-carotene, a precursor found in plant-based foods. It plays a crucial role in vision, immune function, cell growth, and skin health. Deficiency diseases. Night blindness, nyctalopia, one of the earliest and most characteristic signs of vitamin A deficiency. Individuals with this condition find it difficult to see in low light. Imagine trying to navigate a dimly lit room. That's the daily struggle. Xerophthalmia, a more severe consequence, leading to dry eyes, corneal ulceration, and potentially blindness. The surface of the eye loses its moisture and protective layers, becoming vulnerable to damage. Increased susceptibility to infections. Vitamin A is vital for the proper functioning of the immune system. A deficiency can impair the body's ability to fight off infections, making individuals more prone to illnesses. Keratinization of the skin. The skin may become dry, rough, and scaly due to the lack of vitamin A's influence on cell development. Symptoms of deficiency. Beyond the diseases, milder deficiencies can manifest as dry skin and hair, frequent infections, delayed growth in children, poor wound healing, by spots, small, foamy plaques on the conjunctiva of the eye. Remedies and sources. The good news is that vitamin A deficiency is often reversible with adequate intake. Dietary sources. Retinol, liver, fatty fish, eggs, dairy products. Beta-carotene, carrots, sweet potatoes, spinach, kale, pumpkin, mangoes, papayas. The vibrant orange and dark green hues often signal a good source of beta-carotene. Supplementation. In cases of severe deficiency or malabsorption, healthcare professionals may recommend vitamin A supplements. However, it's crucial to take these under medical guidance as excessive intake can be toxic. Interactive element. Have you ever noticed your vision struggling in dim light? Or perhaps experienced unusually dry skin? These could be subtle clues your body is sending. Share your experiences in the comments below. Vitamin B1. Thiamine. The energy liberator. Thiamine, a water-soluble B vitamin, is essential for carbohydrate metabolism, nerve function, and muscle function. It helps convert the food we eat into energy that our cells can use. Deficiency disease. Beriberi. The classic thiamine deficiency disease, primarily affecting the cardiovascular and nervous systems. There are two main types. Wet beriberi, characterized by fluid accumulation, edema, shortness of breath, and heart problems. The heart struggles to pump blood effectively. Dry beriberi primarily affects the nervous system, leading to nerve damage, neuropathy, muscle weakness, and paralysis. Wernicke-Korsakoff syndrome. Often seen in individuals with chronic alcohol abuse, this severe neurological disorder involves confusion, eye movement abnormalities, and impaired coordination, Wernicke's encephalopathy, which can progress to memory loss and confabulation, making up stories, in Korsakoff's psychosis. Alcohol interferes with thiamine absorption and utilization. Symptoms of deficiency. Milder deficiencies can present with fatigue and weakness, irritability, loss of appetite, digestive issues, tingling or numbness in the extremities. Remedies and sources. Replenishing thiamine levels is key to recovery. Dietary sources. Whole grains, brown rice, oats, legumes, beans, lentils, nuts, seeds, pork. Look for fortified cereals and breads as well. Supplementation. Thiamine supplements are often used to treat beriberi and Wernicke-Korsakoff syndrome, typically administered under medical supervision, sometimes intravenously in severe cases. Interactive element. Are whole grains a regular part of your diet? What are your favorite thiamine-rich foods? Let's share some delicious and healthy meal ideas. Vitamin B2. Riboflavin. The cellular energizer and antioxidant riboflavin, another water-soluble B vitamin, plays a vital role in energy production, cellular growth, and the metabolism of fats, carbohydrates, and proteins. It also acts as an antioxidant, helping to protect cells from damage. Deficiency disease. Arabiflavinosis. The name for riboflavin deficiency, although severe forms are relatively rare in developed countries. Symptoms of deficiency. Deficiency often manifests with a constellation of symptoms. Sore throat, inflammation of the mucous membranes, mouth, tongue, glossitis, inflamed tongue, chylitis, cracked lips at the corners. Skin disorders, dermatitis, red and itchy eyes, anemia. Remedies and sources. Increasing riboflavin intake can alleviate deficiency symptoms. Dietary sources. Dairy products, milk, yogurt, cheese, eggs, liver, kidney, leafy green vegetables, spinach, kale, almonds. Supplementation. Riboflavin supplements are available and may be recommended in specific cases. Interactive element. Do you experience frequent mouth sores or chapped lips? While other factors can be at play, ensuring adequate riboflavin intake is important. What are your go-to foods for healthy skin and mucous membranes? Vitamin B3. Niacin. The metabolic maestro and DNA repair niacin, a water-soluble B vitamin, exists in two main forms: nicotinic acid and nicotinamide. It's crucial for energy metabolism, DNA repair, and cell signaling. Deficiency disease. Pellagra, the classic niacin deficiency disease, characterized by the 3 Ds. Dermatitis, a pigmented rash, often in sun-exposed areas, diarrhea, and dementia. If left untreated, it can be fatal. Symptoms of deficiency. Milder deficiencies can involve digestive problems, fatigue, headache, memory loss, irritability. Remedies and sources. Addressing niacin deficiency involves dietary changes and sometimes supplementation. Dietary sources. Meat, especially poultry and fish, whole grains, legumes, nuts, seeds. The body can also synthesize niacin from the amino acid tryptophan. Supplementation. Niacin supplements, both nicotinic acid and nicotinamide, are used to treat pellagra and sometimes to manage cholesterol levels, but should only be taken under medical supervision due to potential side effects. Interactive element. Have you ever heard of the 3 Ds of pellagra? It's a stark reminder of the importance of a balanced diet. What are some niacin-rich meals you enjoy? Vitamin B5, pantothenic acid, the versatile helper. Pantothenic acid, a water-soluble B vitamin, is involved in a wide range of metabolic processes, including the synthesis of coenzyme A, CoA, which is essential for energy production from fats, carbohydrates, and proteins. Deficiency disease. Isolated pantothenic acid deficiency is rare in humans because it's widely distributed in foods. However, it can occur in cases of severe malnutrition. Symptoms of deficiency. Rare. When deficiency does occur, symptoms may include fatigue, headache, irritability, numbness and tingling in the hands and feet, sleep disturbances, stomach pain. Remedies and sources. Ensuring a varied diet is usually sufficient to meet pantothenic acid needs. Dietary sources. Found in a wide variety of foods, including meat, poultry, fish, whole grains, legumes, eggs, milk, and vegetables like broccoli and avocados. Its name, pantos, means everywhere in Greek, reflecting its widespread presence in food. Supplementation. Pantothenic acid supplements are available but rarely needed. Interactive element. Given its abundance in various foods, are you surprised that pantothenic acid deficiency is uncommon? What are some of the staple foods in your diet that likely contribute to your intake? Vitamin B6. Pyridoxine, the amino acid and neurotransmitter expert. Vitamin B6, a water-soluble B vitamin, exists in several forms, including pyridoxine, pyridoxal, and pyridoxamine. It plays a critical role in amino acid metabolism, neurotransmitter synthesis, like serotonin, dopamine, and GABA, immune function, and the formation of red blood cells. Deficiency disease. Severe vitamin B6 deficiency is uncommon but can occur in individuals with alcoholism, kidney disease, or certain genetic disorders, as well as in those taking certain medications. Symptoms of deficiency. Deficiency can manifest in various ways. Skin problems, dermatitis with a red, itchy rash, anemia, microcytic, neurological symptoms, seizures, depression, confusion, weakened immune function, sore tongue, glossitis. Remedies and sources. Increasing vitamin B6 intake can reverse deficiency. Dietary sources: poultry, fish, potatoes, bananas, legumes, fortified cereals. Supplementation. Vitamin B6 supplements are used to treat deficiency and sometimes for other conditions under medical guidance. High doses can be toxic, leading to nerve damage. Interactive element. Bananas and potatoes, surprisingly good sources of vitamin B6. What are your favorite ways to include these in your meals? Have you ever considered the link between diet and mood due to neurotransmitter synthesis? Vitamin B7, biotin. The beauty and metabolic aid. Biotin, a water-soluble B vitamin, is essential for the metabolism of carbohydrates, fats, and proteins. It's also known for its role in maintaining healthy hair, skin, and nails. Deficiency disease. Biotin deficiency is rare because it's found in many foods, and our gut bacteria can also produce it. However, long-term consumption of raw egg whites, which contain avidin, a protein that binds to biotin and prevents its absorption, can lead to deficiency. Symptoms of deficiency. Rare. When deficiency occurs, symptoms may include hair loss, alopecia, skin rash, dermatitis, brittle nails, neurological symptoms, depression, lethargy, tingling in the extremities. Remedies and sources. Dietary intake usually suffices to maintain adequate biotin levels. Dietary sources: eggs, cooked, liver, nuts, almonds, peanuts, walnuts, seeds, salmon, avocados, sweet potatoes. Supplementation. Biotin supplements are popular for hair, skin, and nail health, but evidence of their effectiveness in healthy individuals is limited. They are used to treat confirmed biotin deficiency. Interactive element. The idea of raw egg whites depleting biotin is quite interesting. Do you have any unusual food facts you'd like to share? What are your go-to foods for healthy hair and skin? Vitamin B9, folate. The cell growth and development champion. Folate, a water-soluble B vitamin, is crucial for cell division, DNA synthesis, and the formation of red blood cells. The synthetic form of folate used in supplements and fortified foods is called folic acid. Deficiency disease. Folate deficiency anemia, megaloblastic anemia, characterized by the production of large, abnormal red blood cells that cannot carry oxygen effectively, leading to fatigue, weakness, and shortness of breath. Neural tube defects in infants. Adequate folate intake during pregnancy is critical for the proper development of the baby's brain and spinal cord. Deficiency can lead to serious birth defects like spina bifida. Symptoms of deficiency. Besides anemia, folate deficiency can cause fatigue, irritability, headache, sore tongue, digestive problems. Remedies and sources. Increasing folate intake is essential, especially for women of childbearing age. Dietary sources. Leafy green vegetables, spinach, kale, collard greens, legumes, lentils, beans, citrus fruits, fortified grains. Supplementation. Folic acid supplements are often recommended for pregnant women and individuals with folate deficiency. Interactive element. The importance of folate during pregnancy cannot be overstated. What are some delicious ways to incorporate more leafy greens into your diet? Share your favorite recipes. Vitamin B12. Cobalamin, the nerve and blood cell guardian. Vitamin B12, a water-soluble B vitamin, is essential for nerve function, red blood cell formation, and DNA synthesis. It's unique among vitamins because it's primarily found in animal products. Deficiency disease. Vitamin B12 deficiency anemia. Pernicious anemia. Similar to folate deficiency anemia, it results in large, abnormal red blood cells. It's often caused by a lack of intrinsic factor, a protein produced in the stomach that helps with B12 absorption. Neurological problems. Vitamin B12 deficiency can lead to nerve damage, causing symptoms like numbness, tingling, weakness, difficulty walking, memory problems, and confusion. These neurological effects can be irreversible if left untreated. Symptoms of deficiency. Deficiency can manifest with fatigue and weakness, pale skin, sore tongue, numbness or tingling in the hands and feet, difficulty walking, memory problems, irritability. Remedies and sources. Since vitamin B12 is mainly found in animal products, vegetarians and vegans are at higher risk of deficiency and need to ensure adequate intake through other sources. Dietary sources. Meat, poultry, fish, eggs, dairy products. Fortified foods and supplements. Fortified plant-based milks, nutritional yeast, and B12 supplements are crucial for vegetarians and vegans. B12 injections or sublingual tablets may be necessary for individuals with absorption problems. Interactive element. Are you a vegetarian or vegan? How do you ensure you're getting enough vitamin B12? Share your tips and favorite fortified foods. Vitamin C, ascorbic acid, the immune booster and antioxidant powerhouse. Vitamin C, a water-soluble vitamin, is a potent antioxidant that plays a vital role in immune function, collagen synthesis, important for skin, blood vessels, bones, and cartilage, and the absorption of iron. Deficiency disease. Scurvy. The classic vitamin C deficiency disease, characterized by fatigue, weakness, gum disease, swollen, bleeding gums, skin hemorrhages, bruising, and poor wound healing. Sailors on long voyages without fresh fruits and vegetables were historically prone to scurvy. Symptoms of deficiency. Milder deficiencies can lead to fatigue, weakness, irritability, joint pain, increased susceptibility to infection, slow wound healing. Remedies and sources. Increasing vitamin C intake through diet is usually effective. Dietary sources. Citrus fruits, oranges, lemons, grapefruits, berries, strawberries, blueberries, bell peppers, broccoli, tomatoes, kiwi. Supplementation. Vitamin C supplements are widely available and often taken to boost immunity. While generally safe, high doses can cause digestive issues. Interactive element. What are your favorite vitamin C-rich fruits and vegetables? Do you reach for a glass of orange juice when you feel a cold coming on? Let's discuss the role of vitamin C in immunity. Vitamin D. The sunshine vitamin and bone builder. Vitamin D, a fat-soluble vitamin, plays a crucial role in calcium absorption, bone health, immune function, and cell growth. Our bodies can synthesize vitamin D when our skin is exposed to sunlight, UVB rays. Deficiency disease. Rickets, in children, characterized by soft and weakened bones, leading to bone pain, skeletal deformities, bowed legs, and delayed growth. Osteomalacia, in adults. Similar to rickets, it involves soft and weakened bones, leading to bone pain, muscle weakness, and increased risk of fractures. Symptoms of deficiency. Vitamin D deficiency can be subtle, but may include fatigue and weakness, bone pain, muscle weakness, frequent infections. Remedies and sources. Increasing vitamin D levels can be achieved through sunlight exposure, diet, and supplementation. Sunlight. Aim for 10-30 minutes of midday sun exposure several times a week, depending on skin tone, location, and time of year. However, be mindful of sun safety and avoid sunburn. Dietary sources. Fatty fish, salmon, mackerel, tuna, egg yolks, fortified foods, milk, cereals, orange juice. Supplementation. Vitamin D supplements, D2 or D3, are often recommended, especially for individuals with limited sun exposure or malabsorption issues. Blood tests can determine vitamin D levels. Interactive element. How much sun exposure do you typically get? Do you live in a region with limited sunlight during certain times of the year? Let's discuss strategies for maintaining healthy vitamin D levels. Vitamin E. The powerful antioxidant and cell protector. Vitamin E, a fat-soluble vitamin, is a potent antioxidant that helps protect cells from damage caused by free radicals. It also plays a role in immune function and blood clotting. Deficiency disease. Vitamin E deficiency is rare in healthy individuals with a balanced diet. It's more likely to occur in people with fat malabsorption disorders or certain genetic conditions. Symptoms of deficiency. Rare. When deficiency occurs, symptoms may include nerve damage, neuropathy, muscle weakness, loss of coordination, vision problems, weakened immune function.